welcome to the first of our NEET SS topper interview sessions for this year. So, as you all know, this is our third year, actually speaking, after the launch of the NEET SS app by Marrow. We started off in 2021, so that was a different pattern exam. And then we had an exam in 2022 and now an exam in 2023. So, it's the third of its kind. And this time around, for a topper interview, like last year. So, last year I did two topper interviews, both were from KEM Bombay. And this time also we are having a topper from KEM Mumbai. This is Dr. Raghavendra, who scored rank 2 for NEET PG in 2020 and now rank 3 for NEET SS in 2023. So a proper topper. So many of the students always tell us we are unable to relate to toppers in many ways. So we'll see how he thinks and how he was able to go through some of the hurdles that he faced, especially because of the fact that his course was so much affected by COVID. So we'll just try to see through all those things and we'll welcome him to the show. So not a question per se, but I just want you to give an insight on how you felt about the exam on the whole. Because whether you were very serious about the exam like NEET PG where you have to crack and there is no other option, or if you're taking it on a much lighter note and you just went to write and it happened so. So what's your theory about this whole exam?
Yeah, so first of all, I just would like to begin by saying that thank you for having me on this platform. And Marrow is actually the thing that I used for my preparation. The crux of my preparation was based on Marrow. So basically, yeah, it was a kind of serious approach towards this exam only. I had made up my mind that I had to get a good rank, and my aim was to get a good seat, preferably in Mumbai and in endocrinology branch. So I had to go with a proper dedicated approach towards this exam. My preparation actually had started just 3 months back. That's actually was not that well planned, but just after my MUHS practical exam was over of MD General Medicine, I subscribed to Marrow 3 months plan, and then I started studying from it. My basic approach was actually more of solving questions from the question bank and giving the weekly tests as well as the grand tests. And I tried to complete most of the modules from the question bank as well as the tests that were there in the test series. Initially, actually, the date for NEET SS was, I think, 5th September, and then it got uh, postponed to 29 September. That was actually, I would say, a kind of good thing because initially I had planned on just solving the QBank modules and the test series, but then later I thought maybe I should also have a look at the videos, especially the high yield videos, the recall videos, and the MCQ discussion videos which were there. So it was basically towards the last 1 month of my preparation that I used these particular videos, which were very high yielding and a very good source to revise whatever I had studied in the last 2 months with the help of the question banks and the test series.
So before you actually run away, I just want to break and ask you a question because many of the students are expecting this question. That means now is the time when many people are joining PG. So you joined PG in 2020. It was a very bad time, torrid time that you joined your PG. So what really happened in your first year of your PG course? Many of the people are with the assumption that, okay, I have to study something, I have no knowledge, etc. So you are a person who had reasonable knowledge, that's why you got ranked 2. So you went into the course, but the course was troubled by COVID, etc. So just take us through your journey of your first year of your PG course and what you could have done better when you think back. And just in brief about your second year of your PG course and third year of your course.
Yeah, so actually I couldn't divide my PG course into 3 years. It was just 2 years for us because of COVID. For
Yeah.
us, the first year had extended to almost 18 to 19 months before the juniors arrived. And the second year was cut short to just 2 months, followed by the third year, which was an entire 1 year. So during the first year, because of COVID, uh, there we had to do COVID duties as well as manage other normal patients in wards. So at that time, there was a lot of crunch of time, and I could not get enough time to read the theory. So at that time, I had made my mind to focus mainly on patient care, learn from my seniors, learn from all the faculty members at Department of General Medicine at KEM Hospital. So that's how my first year actually went. It was more towards the second and third year that I actually started reading more from theory. Once I had gained enough knowledge regarding patient care during my first year, the extended first year of almost 18 months. And then I tried to consolidate that knowledge with the theory which I read from Harrison. and as well as from other sources like basically the guidelines for say management of diabetes, hypertension, heart failure guidelines, and all those things, HIV guidelines as well.
Yeah. So what do you feel as a recommendation? So you haven't read anything much for the first 18 months because the course was very hectic. So most of the students are like that. They generally don't read anything during the first 2 years. Most of the colleges are like that. So suddenly when you think of reading something in final year and now that your final year is over, what do you feel is an ideal way of reading in final year? Or do we actually have to depend on online sources more? Or is it better to go to the conventional way and read Harrison? What is your feeling after having seen the videos and having read from the books? What is an ideal method, or you mix and match and read, or what should be an ideal method of reading? Not for the entrance, just for theory part.
So this is after seeing the videos. Actually, what I felt was I actually missed out on seeing the general medicine SS videos or even the super specialty videos which were on offer on Marrow, because I had very little time to watch the all the videos. So I had basically invested whatever little time I had in watching the high yield topics and the MCQ discussions. But what my message to all other students who are preparing for NEET SS and are currently in maybe second or third year of their MD course would be that they should try to start a little earlier, maybe 1 year prior to the date of exam. So if the exam is in next year, September 2024, so they should ideally start now in October or September, October that is. So initially a combination of both actually, seeing the medicine videos, general medicine SS videos from Marrow, and combining it with reading from Harrison, and also making your own notes. Combining these three things, I think, would be an ideal technique. Plus, also when you read a certain topic, say today, then you should make it a point to revise that same topic maybe a week later or a week later or so, because that is how our memory actually works. That is, if we revise often, then we'll tend to remember it. And there's no better method of revising a thing than to solve MCQs on a particular topic. So once we know what we are forgetting, then we will not forget the same thing again in future. So timing that particular revision session, maybe 1 week or 2 week later, is I think of utmost importance.
My question with respect to that would be like, do you see SS entrance preparation and final year preparation as two different things, or are they two things which actually go hand in hand? My personal viewpoint is that they go hand in hand. We don't need to have any specific preparation strategy because medicine
Yes.
is the exam, the syllabus now. So, can somebody who's studying in final year study properly, and that will cater to both his needs?
Yes, I think that is very true, because that is what I just advised, that those who are currently in their third year, they should start studying from Marrow as well as Harrison simultaneously and cover similar topics. So if one student has seen a particular video on Marrow, then the same thing can be read from Harrison and combined notes can be made. Important things can be highlighted that way. So yeah, both the preparation can actually go hand in hand, because what we require mainly are the concepts, and even the questions that were there this year in NEET SS, those were more concept based, and uh, there were also many case based scenarios. So if we have seen those patients and read about them in the books, it's a lot easier to tackle such questions and answer them correctly.
Yeah, so I perfectly agree with you, but I think if you're planning to watch the videos and then read Harrison, it takes too much of a time. So I am a strong believer that even if you don't read Harrison, nothing will happen. But that's again a personal choice. So if you are actually sticking onto the video, I think the video has more conceptual content and more updated content than Harrison. So essentially, if it depends on the time you have. Even if you can actually watch off the videos, general medicine part, I think that's more than enough. Now my question is with respect to the specialty videos apart from medicine that we have on the app. So what about cardio, neuro, nephro, gastro? Do you get time to watch any of those things, and what is your personal
Uh,
feeling about it?
no, sir. Just as what I mentioned earlier in the video, I had subscribed to Marrow just 3 months prior to the exam, so
Yeah,
I could not get enough time to see either the general medicine or the super specialty videos. I basically relied more on my knowledge that I'd acquired from MD medicine over the
correct.
3 years, and the text matter that I had studied over the 3 years, and
I
then consolidated it with the test series, question banks, and even
see.
the theory matter which is given along with the explanation of each question,
Yes,
and
yes,
certain important points which are highlighted in the explanation of each question. Those are
yes.
very high yielding points, in fact. And each highlighted point I feel is an MCQ. So
Yes.
even if we solve just one MCQ, Along with that, at least 2 or 3 more MCQs get covered, and those concepts are uh, like very easy to understand also.
There is a general misconception among students that our question bank and test series is a little too tough. Do you agree with that? Is it like too tough, or you felt it's like one step above the exam or two steps above the exam? When you finally wrote the exam, what did you feel?
Uh, if we have the prior knowledge of those particular topics, or we have seen the videos previously, then maybe they are not so tough. But if we try to attempt them de novo before having any theoretical base, before having a look at the videos, then they appear to be tough. Yes.
So I think, in a nutshell, what you are trying to convey as a strong message is what we also used to say years ago, that doing our PG course with utmost sincerity is the most important part of it. But then your concepts are a little different in the sense that you've studied from a very high volume college, a college where cases are pouring left, right, and center. But we also have a lot of candidates who are coming from centers which are not as great as KM, where they are not getting exposed to those many cases. Can you just devise a plan for somebody who is very sincere in approach but not seeing so many patients? So they feel like they are always on the losing side. But in reality, for the entrance exam, they can easily crack too. So what is your feelings? If you're not getting that much exposure, how would you advise them to go about with their course?
Well, in that case, I feel the general medicine SS videos would actually be sufficient for them if they are planning to crack the NEET SS. For INICT, maybe it's a different story. I'm actually not planning for INICT, but for that, maybe super specialty based videos are more important. But
Yeah.
from the point of view of cracking NEET SS, I feel general medicine videos starting at an early stage, that is 1 year prior to the date of exam, and making either your own notes or referring to Marrow notes, which are there along with each video. Either one of them is a good option. And whatever cases that they see, even if the patient load may not be that high, but if whatever case they see, if they're able to apply that same knowledge in patient management, I feel it becomes easier to remember also what we
Correct.
study, and then if you apply that same thing on the on patient management.
Yeah, perfect. So, like many of the students also complain about the fact that there is no academics in my college. There is no academics in my college. So, I just keep on thinking about, is academics actually speaking so much necessary for PG? This is not a UG course. UG course may definitely academics is mandatory, but in a PG course, should we be actually overburdened with so much academics? What is your take on that? Did you have so much academics in your college, or is it necessary, or is it sometimes like an overburdening kind of?
Uh, the academics at KEM is quite strong. We used to have almost daily sessions. Like a day was dedicated to journal club, then case discussions, case presentations twice a week,
Yeah.
followed by seminar presentation by us on various topics, recent as well as common topics, at least once a week. So academics was pretty strong at KEM, but so it's actually a bit difficult for me to say whether academics are so important or no. But for me, the presence of those academics actually helped me a lot.
Helped you. Okay, very good. So, what about specialty postings? Take us through your specialty postings and what were your major take-home points from each of the specialty postings.
We had only four super specialty postings:
Because of COVID.
endocrine, nephro, cardio, and I said endocrine, nephro, cardio, and hemat, GI med, that way.
Okay.
So,
That,
but because of COVID and only 2 months of second year, we had only 15 days for each super specialty posting. We did get exposure to a lot of patients, but even in that case, having only 15 days of super specialty exposure is not that sufficient. It was all because of COVID. Maybe the junior batches are getting more exposure to these specialty cases.
okay, fine. And what makes you zero down to endocrine? So, you were talking about the fact that you want to pursue endocrine as a career. So, is it because you've studied at KM and seen the department, or is it something that you feel special about the subject?
I feel it's more of a very thought-provoking subject.
Yeah.
Almost all subjects are thought-provoking, but that is one subject which I felt was quite intriguing, and for some reason I felt that that is the subject I wanted to pursue. Also, a secondary factor was that I was not very fond of an interventional branch,
Okay.
so that might have played some role in me deciding to take endocrine.
Fine. So, as we always say in class, no, thought process is the king in endocrine. So for every subject, there is a king. Like you say, skill is the king for gastro, or you say knowledge is the king for neurology. Here it is all about thought process. So thought process is what that drives you forward in endocrine. So anybody pursuing endocrine has to be very intelligent. He has to be having a good thought process. It has to come in a flow. Otherwise, it's not practical to study the subject. So my next question is that if you are actually thinking of making a proper plan for NEET SS post your MD, suppose somebody doesn't clear in the first attempt. So many people are actually preparing are repeaters. So you are not per se a repeater yourself, but still, if you want to advise somebody who is not clear and planning to clear the exam next year, will you advise him to work one for 6-7 months and then start preparation, or start preparation now itself? Or what would be your general advice to somebody who is writing the exam after a year or a gap?
Okay. So it actually depends on individual capacities of people, whether they feel they can manage working along with studying for NEET SS. Depends on where they are working, how the workload is at that particular place. But yeah, if I was in that particular position, I might have started working for say 6 or 7 months, and then in the last 3 or 4 months, I would have given a dedicated time to studies only for NEET SS.
Okay, fine. And in case you are asked with respect to notes, now we are having a lot of what do you say requests with respect to PDF of the notes, handwritten notes, making your own notes. There's a lot of confusion with respect to that. What is your general idea? What do you do generally with respect to notes? Do you have your own proper notes right from UG times? How have been your approach with respect to notes?
So for NEET PG, I had prepared my own notes from whatever classes I had attended.
Okay.
The story was a bit different for NEET SS because of the lack of time and there being just 3 months between my
Yeah.
MUHS MD exams and NEET SS. So I did not have enough time to make my own notes. Although I did have the notes which I had prepared for my MD exams, especially the newer guidelines or notes of those topics which I found difficult myself to remember. But yes, my personal opinion is that having your own notes, having that notebook is very important because in that particular notebook, you know what you have written, what points you have highlighted, and what all things are there which you tend to forget more. So, uh, all in all, it becomes a very concise material to revise even towards the last part of your preparation.
Okay. So, like again, a lot of UG students will also be watching this, especially from Maharashtra, and where you're having immense following. So, again, this with respect to your NEET PG rank, no? Did you ever have a thought with respect to should I take medicine where the course never ends, or should I take up something like radiology, which is much more easier? Did you have a thought like that at that point?
No, never like that. Medicine is something that I had always wanted, and yeah, and endocrine is also a branch which is like very very close to medicine. Not just with respect to the diseases that are there under endocrine, but even the general management of the patient and everything else is very medicine in endocrine. That's why.
No, did you make up your mind that you were going to do endocrine at a much earlier point itself, or only now that you decided?
No, I guess that was more towards my third year during my registrarship
Okay.
that I decided that I had to do endocrine.
That you were already fixed with respect to that. So I think that's a great idea. You know, many of the people who are writing this exam really don't have any idea of what they want to pursue. They feel that okay, we get a rank, and that's a very wrong way of looking at it, because each of these subjects, although coming under general medicine, have absolutely no relation to each other. The way they are pursued, the way a cardiologist goes about this job, and the way endocrinologist goes about this job are totally unrelated. So saying that both cardiology and endocrinology come under medicine makes no sense, because they are two different specialties. It is like totally different two subjects. So in that way, the fact that you have a very clear idea that you're going ahead with endocrine itself is, I think, a very, very positive thing, really, really positive thing. So now I think you've used this for 3 months now. Any suggestions from your side? Because it's a new kid on the block, this Marrow SS. It is not there for a long time, as I told you. This is only in 2021, June, July that we actually launched this. It's actually just 2 years plus old. So any suggestion from your side with respect to anything that could be added or subtracted to make this even better?
I guess I can't currently think of any particular suggestion because it's actually a very brilliant platform. The way I managed to use Marrow to the fullest extent possible in these 3 months and managed to get this rank, I think Marrow helped me a lot. Uh, like starting from everything, question bank, test series, the high yield series videos. I missed out on seeing the general medicine SS videos, but I guess they must be as good as everything else that is there on offer on Marrow.
I think now you can actually start watching endocrinology SS videos. They may be very useful for your DM final exam preparation. And I
True,
think
true.
my
I was actually planning on that.
yeah, that is going to be a must watch for you, because I think learning that and going into your course will be very easy for you. Because I think going into the course, the challenge that a medicine person faces in endocrine is that 25% of the course is pediatrics and gynec, which obviously you will not be having any idea of. So watching these videos and then going into the course will actually put you on a very safe note. Medicine side, I think, will be reasonably okay, but again, to get used to the investigations, the language which is a little different. The PG language that we use and the SS language that we use with respect to endocrine are a little different. So that I think will be of immense use to you. So once again, thank you so much. Thank you, really. And my last question for you is on the need for this. This is a question again with so many. Whatever questions I've asked you are questions that relate. Okay. Generally, students ask me. I have my own answers. I'm just trying to see what you feel now. So what if you not do a super specialty? This is another question that so many people ask. What if we stop with medicine and not study anymore? Okay, what is wrong? Because when we study medicine, we are actually made a physician. India is in need of more physicians than super specialists. And of course, having studied from a top college, you will be able to contribute as a physician also. So what is the idea behind that? Is it really mandatory to do, or is it a choice or a necessity?
Whether it is mandatory to do or no also depends on where we belong from. So I come from Mumbai. It kind of becomes a bit important to do a super specialty course. Although I do not say that an MD medicine physician cannot survive in Mumbai or cannot practice in Mumbai. I would be wrong to say that. So, but in other areas, maybe in the peripheries or even in other metropolitan cities, an MD medicine physician can actually practice, and it's not completely mandatory to do a specialization course.
Yeah. So that's my take on that also. That means if both of us do DM endocrine from KEM Bombay, I think most likely 99% of what we do with respect to a patient will be the same, because it's a set guideline based, set piece based practice. So nothing much is going to be different between us. But if both of us are classmates for MD general medicine course at KEM, still the difference can be so much. I may be very bad, you may be very good, I may be brilliant. It can be so different. So individual prowess, if you want to show off with respect to diagnosis, then of course it is physician. And super speciality means it is more your management skills that come to the fore than your diagnostic skills. So that is how we look at it. So extremely happy to converse with you, Raghavendra, and I think big congrats on your huge success. And hopefully we can see you as somebody big in endocrine in some big endocrine conference somewhere in the country. So once again, thanking you. I'm very happy that we have been able to produce toppers so consistently. So once again, thank you, Raghavendra, and all the best for your future endeavors. Thanks so much.
Thank you so much, sir. Thank you so much for your blessings and especially all your high yield topic videos. The clarity with which you explained all the concepts. It's like even if you ask something right now, I'll be able to remember that and also extend all those concepts onto patient management as well. The videos actually were very crisp and clear, and concepts were uh, very clear. Yeah.
Okay. Thank you so much.